Hi everyone, my name is Paul Fontanez. Looking forward to this class. I've been a nurse for 21 years. I started off in a med-surg telemetry unit in a cardiac hospital in Long Island, New York. I then transferred to New York City, worked at New York Presbyterian Cornell in their CTICU for about 5 years. And then became their assistant manager for a couple months, and then they wanted me to manage a cardiac medicine floor. I did that for about 2 years. At that time, then I relocated to Connecticut. My director relocated to Yale Newman Hospital, and so she told me about a position in CTICU over here. So I came over, started as a manager at CTICU. I was doing that for about 3 years. And then, had two kids and needed to become just a nurse and not manage a unit. So I went to the recovery room as a nurse. I've been in the recovery room on the York Street campus for about, I would say 10 years. And on and off, I stepped into interim assistant manager 3 or 4 times as management has cycled through. And then finally, the last manager that came through wanted to keep me on, so I became an assistant manager for about a year. And then a manager position opened up at our St. Raphael's campus, so I went ahead and took the manager position there, and I've been doing that for about 2 years. And just recently, about a month and a half ago, the manager left the York Street campus, so now I'm managing two campus recovery rooms. So that's been busy. And so that's what I've been doing recently. As far as data, I've worked with Sunrise Clinical Systems, Cerner, and now with Epic. As far as Epic is concerned, I've just submitted to make some additions to flow sheets and different things like that. My most recent project I'm still working on was developing a nausea scale for the recovery room. Some of the surgeons came up to, actually, one of the peripheral nerve block doctors came up to me and asked, do we have anything to measure nausea in Epic? And when we looked, there was nothing specific to what we were looking for, just a couple things on the oncology flow sheets. So started looking at some research and tried to see which nausea scale would be best used. We found this one that was similar to the pain scale, so we're using that. We're starting a pilot in 2 weeks, and goal is to use it on every patient in the recovery room at St. Raphael's campus first, and then introduce it to York Street campus. Also on the one inpatient floor, they're just using it on ortho patients, and it was just submitted, probably be in a couple months, to present to the system-wide Epic perioperative system-wide to see if we can promote it as a system and put it into our regular flow sheets after we prove that it works. So that's pretty much it as far as what I'm doing with data. My goal in this course is kind of to learn how to put it all together. I feel like my learning up to this point has been piecemeal. I'd like to get a little more confident in my knowledge and skills with data. And thank you.